Can I see what? Can you try giving me a thumbs up? Can I see? No? Okay. Prefer to use your head? Yeah. Let's just try it out. Let's just try and see. See what you use. Okay. So your name is Sue? Is your name Steve? No. Good. Are you 75? Yeah. How about, are you 86? Yeah? Yeah? According to what I see here, you're 86. Okay. Alright. Over here, is this your husband? Yeah? Is this your uncle? Yeah. I see you trying. The reason we talk about yeses and nos is the nurses, they're gonna be asking you lots of questions. And I wanna make sure that if they ask you about something, like bathroom or pain, those really important things, that if you're telling them yes, they know that you mean yes. Or if you say no, they know that you mean no. So that way they're not bugging you or having you do something that you don't really need or want. So that's partly why we're going over this right now, and I'm just taking a look at how you're expressing that, ways that we can work on it together, because it's important. That makes sense? Yeah? Okay. Alright. Let's see. Okay. Do you live in San Jose? No? Okay. Where do you live?
San Jose.
Yeah? Okay. San Jose. I know San Jose is kind of big.
Yeah, well, we're close.
Okay.
We're like 3 miles away.
Oh, alright.
Yeah.
Were you working? No. Retired? Yeah. Alright. Let's see. Do you have any kids, Sue? No? No? Any kids?
Yes,
Okay.
but they're estranged.
Got it.
So it's a very painful subject.
Got it. Okay. Any pets? Any pets?
No pets. We used to.
Okay. What are some things that she enjoyed doing? Like any hobbies or things that she enjoyed?
No, that's been a difficulty for her. She's this transition from non-working has been difficult.
Okay.
I'm a hobby person, baking, gardening, variety of things. About a year and a half ago, she decided she was going to try to make a hobby, and we bought a bunch of little rocks about this big. You can buy a bag of like black rocks from Amazon, like 5 pounds or whatever. So she bought a bunch of those in some permanent colored pins and started decorating rocks that way. And she did that for several months, but I would ask her, I said, are you enjoying it or whatever? But no, it was like forcing her to do something because you should be having a hobby.
Oh,
So I love what she did. And she looks at me like I'm crazy. Like I'm not an artist, but I love it because it's her.
Yeah. Okay.
So that was about the closest thing to a hobby. I mean, kind of our routine in the evening after dinner is we'd watch a movie on Amazon live streaming on Amazon Prime. And then we like to talk about the meaning of movies.
Okay.
And one of the things that I learned recently is I'd go into AI and I'd ask questions like, what is the meaning and significance of XYZ movie that came out in 2015? And they would give me some wonderful answers. And I'd ask things like, what's the meaning of the title of the movie? And ask about the dynamics of the characters. Because sometimes there are subtle messages within a movie that you just see it at a glimpse. Like if you watch it several times, you might totally get it. And so we loved, or I think we loved, to do that. I mean, there were certain movies that were really significant that were not, they were art house movies that the AI was very instructive in terms of talking about the depth of the character and the storyline and all that kind of thing. So we would talk about that. That was one of our things. Suzy is very much into what I call the psycho-spiritual world. I don't know if you're familiar with the area of thought called non-duality. Does that ring a bell at all? Well, non-duality basically means there's no separation between you and I or anybody in this world. There's just one energy, and there is no body. There's nothing that's real that's on the physical plane. So, so she was into that a lot. Years before we watched, and she's the one that's introduced me to all this stuff. I've been like adjacent. I've developed my own philosophy by being adjacent to her because she's such an explorer. And so she would watch YouTube videos of this nature in the afternoons, and I've asked her if she'd like me to bring in the iPad, which is what she usually would watch that on. Okay. And I talked with a speech therapist early last week, and she said, yeah, you could try that. You might need to slow it down. You might need to have the subtitles up. I've asked her if she wanted to listen to any of that, and she said no. Okay. So I don't know where she's at in that process, but I think she derived a lot of, I want to say personal insight. Often she would listen to somebody, and whatever they were talking about, she says, this is exactly what I'm going through. And she would want me to listen to it so that I had an understanding of her inner world.
Yeah. It's good to feel connected.
Frequently in the morning, like either after breakfast or before, she would say, can I talk to you? And she'd just like to tell me what's going on in her internal world. And for me, that's a challenge right now. She was so verbal and so expressive, and can't do that now.
That's something we're going to work on. That's my job. I wanted to see, I know the speech therapist that did her eval here on Friday or Saturday, I think, didn't get a chance to see you. Was she taking any medications before at home?
Just thyroid. That's it.
Was she managing that by herself?
When you say managing it, what's that mean?
Remembering to take it.
Oh, yeah. I mean, our routine was, so Suzy hasn't seen a regular doctor, personal physician, in about 25 years, maybe 20 years. And that last person was when we lived in Mexico. We lived in Mexico for about 12 years. And she doesn't like doctors, doesn't like medications, doesn't like blood tests, and would do anything to avoid those things. Yeah. And so we have a number of friends that live in Mexico, regularly travel back, and they would bring her meds. So I have about a 2 to 3 year supply of her thyroid meds in our freezer. Okay. hermetically sealed in Ziploc bags and things of that nature. So a couple of years ago, our passports expired, and she was anxious and wanted to get them renewed as a backup. Like if we needed to go get thyroid rather than see a doctor locally, we were going to hop on a plane and go like to Tijuana and get some meds. So that's a little bit about her history. I mean, in terms of she had high blood pressure coming in. Probably 2 decades ago, she had a blood pressure cuff. I don't know if she had high blood pressure, 20 years ago. I do know that she had white coat hypertension.
Okay.
And so anxiety in a medical environment. I don't know if any of this is important for you.
No, yeah, it's good to just get an idea of what was important before, what your day looked like before. It gives us a lot of information about kind of what to work on, what might be the most functional, because it's really different for everybody, their level of independence or things that were important.
Yes.
So it's good. We want to know those things.
Okay.
Was she managing any like finances or anything like that?
No.
Or was that you?
I do that.
Okay.
I do the grocery shopping, the cooking. Kind of her things that she did around the house is she did all the cleaning and organizing, which is a big job with me around, even though we live in a small 2-bedroom, 1-bath duplex. She would water the front lawn, which doesn't have any sprinklers. She likes a green lawn. That's important to her. I've told her we really don't need to deal with that, because on occasions the landlord would say, hey, our water costs have gone up, and I reply with data showing that our water usage is consistent with the average household of 2 people, and I've told the landlord that we can rip out the grass and put in drought tolerant if they want to really reduce their water expenditure. But mainly cleaning, and she's big on organizing. She loves decorating, so on occasion she likes to change things up, move furniture around. We haven't done that in a long time, but she likes little decorative flourishes, like a throw on the bed. She'll buy something that's an accent piece. Okay. We have a bunch of pillows on our sofa, which kind of drives me crazy, but it looks beautiful. You just can't sit on the sofa with all those pillows. So. Nice. Okay. And Suzy, I put the pillows on the sofa every day. Okay? Mm-hmm. I want you to know I'm trying to keep it up.
And those are even things, if there's certain things that we're familiar at home that you want to bring here to spice it up a little bit. You have a small couch over there. I know it's not the same as home, but if you want to bring in some pillows or different things to try to make it feel more homey.
Okay. I had brought an anniversary card that I had made, and I think it got lost in the transfer. It was a photograph of a little puppy that we used to have on the cover, and it had a little caption that said baby, he said mama, and she used to call him baby all the time. He was a Shih Tzu that was precious to us, and on the inside was a selfie of both of us. So if we can recover that, I'd really like to, but I realize it's been several days.
Sure, yeah. I'll ask around, see if anyone's found anything. Okay.
And I brought her the flowers. They're looking a little tired in some cases, some aspects.
All right. Do you want me to call you Sue? Yeah. Or Suzy? No, Sue. Either one? Okay, cool. All right, really quick, I just want to take a look at where you're at, okay? So I have some options here. Right now, where are we? Are we at the bank or the hospital? Yeah, can you show me? Can you point? No.
Can I make a comment?
Sure.
I've seen in the past where the therapist has picked up her hand and said
Yeah.
bank
Yeah.
and hospital, and then she's been able to respond. Now that's
Got
several
it.
days ago.
Okay. Could be like some initiation. Yeah. So, can I touch your hand? Is that okay? This one? Thank you. Here, I'm gonna come over on this side, okay?
Where are the liquids?
Alright. Borrow your hand. Can you make a pointer finger for me? Point. Yeah, this one. Like this. Whoop. Perfect. Right now, are we at the bank or a hospital? Where are we? Hospital. Yeah. Which one? This one. Yeah. Yep. Hospital. That's where we are right now. Hospital. How about what city? Right now, are we in San Jose or Oakland? Where are we? Don't know. That's okay. So we're up here. We're San Jose. That's where we are right now. Yeah. San Jose. Do you know what hospital we're at? There's Kaiser or Santa Clara Valley. Don't know. So we're here. Santa Clara Valley. Yeah. What month are we in, Sue? There's December or June. Yeah. Here, let's try the yes no, okay? I think that might be easier. So right now, is it December? Okay. Is it June? Yeah, right now it's June. Here's our years. Yeah, so right now, is it 2025?
That says 2005.
Oh, yeah, 2005? Okay. Is it 2026? Yeah. Okay. Alright. Sue, can you try to shake your head for me? Like you're saying no. Like this? Yeah, good. How about for yes? Can you like this? Yeah, good. Okay. One more time. No. Can you show me? No. Yeah, good. And yes? Like this. Yes. Yeah. Part of it, I think, too, is I think you're trying to coordinate those movements, but sometimes it's not always happening. So the more that we practice some of those movements, like yes and no, the easier it's going to be to start doing them more consistently for you. Okay? Because right now, I'm noticing that you say yes for a lot, but I don't know if you're always meaning yes. So that's why I really want to work on with you being able to say no or yes. That's one of like the biggest things I think that we could start with. So that way, if he's asking you a question too, you can tell him no or yes. Okay. That sound like a plan? Yeah? Cool.